where your placenta is can change things about what you feel during your pregnancy. This is called an anterior placenta. When your placenta is on the front of your uterus, you will find it on all the ultrasounds that you get during pregnancy. Of course, it's on the inside of the uterus, but it's just easier to show it on the outside. This is a posterior placenta, where the placenta is on the back side of the uterus. Now, a lot of you just seem to think that you are a pregnancy unicorn if you have an anterior placenta. And studies show that it's like 30 to 50%. So not a unicorn at all. Probably about half of the people have an anterior placenta, but it does change what you're going to feel. And so today I want to talk about that.
All nurses to the nurses station.
Really quick, during this, we're going to talk a lot about kick counts. If you're like, Hillary, I have literally no idea what you're talking about, check down below. I'm going to give you my kick count cheat sheet where you can learn how to do them just for you. So I did want to reiterate that the statistics are that 30 to 50% of people have an anterior placenta. So it is just a variation on normal. There's lots of variations on normal during pregnancy. It is not going to affect how your baby is growing. It's one of those very normal things. It's just where the placenta implants. Now, there is something called a placenta previa where it implants on top of the cervix. That is very different. Most people will grow out of that phase, but if your placenta is still over your cervix as you get closer to delivery, then it will change how you deliver. But today we're not talking about that. We're just talking about an anterior placenta. Now, as you can imagine, when this little baby kicks, the placenta can sort of blunt that kicking, especially when the baby is very small and the kicks are not very hard. But by about 24 weeks, the placenta placement doesn't affect how you're feeling baby move as much as it did in the beginning. However, prior to 24 weeks, a lot of times having an anterior placenta means that you feel baby moving a little bit later than people who have a posterior placenta, because most of us are feeling the baby move on the front of our bellies. We're not feeling it in the back near our spine. So as you can imagine, it just kind of blunts those movements from your baby. Now, with baby growing, the kicks are harder, the baby is bigger, they're taking up more of the uterine space. So all of that is why around 24 weeks, it doesn't matter as much. And it doesn't mean that your baby is moving less if you have an anterior placenta. It just means you're feeling it less. And those are two very different things. Now, with all of the information swirling around online, it can be difficult to know what is correct. Make sure that you're taking your information from an expert. And if you would love all of that information in just one place that makes it easy for both you and your partner, I actually have a class that I'll recommend. I'm going to put it down below for you guys. Now, with an anterior placenta, a lot of times people say they cannot do kick counts, and it can be a little bit different, and your kick counts may take a little bit longer. The movement may not feel as abrupt as it might in somebody else, especially if you've had a previous pregnancy where the placenta was in the back. It's going to feel different. But as you will recall, if you look at my kick count cheat sheet, it depends on your baby and this pregnancy. It does not depend on anyone else's baby or any of your previous pregnancies. It's just how this baby moves. That's what you're comparing this baby to. If you have an anterior placenta, it may mean that you have to sit down to really feel those movements, especially in the beginning. Remember, kick counts start at about your beginning of your third trimester, so about 27, 28 weeks of pregnancy. And for me personally, I always did my kick counts after a meal because I knew that was a time that my baby was very active, and so I could get my kick counts done. Did I do them absolutely every night? No, I didn't, but I tried to do them after dinner, both because kick counts are a healthy thing to do, and also I got out of cleaning up dinner because I was growing a baby, and that seemed very fair. Am I right? Tell me down in the comments if that seems fair. Now, kick counts, when done correctly, can save up to 33% of stillbirths. That means 1 in 3 stillbirths could be saved if people were consistently doing their kick counts. So I'm a huge fan of them. No matter where your placenta is, they can be really, really helpful. Just remember, you are only comparing your baby to your baby. So many people get online and they're like, this girl does her kick counts in 5 minutes and it takes me a half an hour. And that's completely fine. It's just comparing your baby to your baby. And the normal range of kick counts is anywhere between even 2+ hours down to, just a few minutes. I will say I had very active babies. I had a posterior placenta, so mine got done very quickly, which was good because I was at work a lot of the times and it was really easy to do them while I sat down and ate really quickly. As a reminder, an anterior placenta does not mean anything about your upcoming birth, unlike a placenta previa. baby is growing very normally and you should be able to have a very normal birth. At least nothing will be from the placenta that makes your delivery any different. Now, if you want a video on placenta previa, then ask me in the comments and I will make a separate one for that one. Now, it is amazing that kick counts can save 33% of stillbirths. I have a whole video on how they can save stillbirths. I'm going to link it up above, but thank you for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.